Read updates in Chinese. For the second time in over a week, China on Thursday changed its criteria for confirming coronavirus cases, throwing into confusion the methodology that the country at the heart of the outbreak uses to track transmissions and resulting in a dramatic decrease in new infections. The new criteria exclude patients from Hubei province, the hardest hit area of the outbreak, who are diagnosed using clinical methods, including CT scans and an assessment of symptoms. Instead, patients there would be counted as having contracted the virus only when confirmed by a specialized nucleic acid test. Using the new criteria, officials in the province on Thursday recorded 349 new cases in the previous 24 hours, bringing the total national figures to 74,576. New deaths rose by 114 on Wednesday, bringing the death toll to 2,118. In its sixth iteration of a diagnosis regime, the government said it would differentiate between suspected and confirmed cases from now on. Cases would only be considered confirmed after genetic testing. Such tests are notoriously difficult to conduct and the results are often wrong. It takes at least 2 days to process the results of the test. The change has caused confusion among public health experts, who said it is now extra difficult to track the outbreak in China. For an epidemiologist, it's really frustrating when case definitions keep on changing, said Benjamin Cowling, a professor of epidemiology at the University of Hong Kong. Why can't they work out what's a probable, suspected and confirmed case? It's totally confusing. Last week, the government switched to counting cases based on diagnoses made in clinical settings, including scanning patients' lungs, in an effort to more quickly isolate and treat patients. Updated February 10, 2020. As a result, however, the country may have overcounted cases because lung scans are an imperfect means to diagnose patients. Even patients with ordinary seasonal flu may develop pneumonia visible on a lung scan. 2 passengers from the cruise ship quarantined in Japan have died after contracting the new coronavirus, the first deaths among the more than 600 people on board who have been infected, a Japanese health ministry official said on Thursday. The 2 people, both Japanese, were an 87-year-old man and an 84-year-old woman, the Japanese broadcaster NHK reported. They were taken to hospitals on February 11 and 12, and both had underlying health issues, the broadcaster said. No other information about them was immediately available. Hundreds of passengers have begun disembarking from the ship, the Diamond Princess, after Japan declared the 2-week quarantine over, even as cases of the virus on the vessel have continued to rise. The authorities have said they are releasing only people who have tested negative for the virus and are showing no symptoms. But experts on infectious diseases have pointed to deficiencies in the quarantine protocols on the ship and questioned the decision to let them go free. A 35-year-old man from Washington state who last month became the first confirmed coronavirus patient in the United States has made a full recovery, health officials in Snohomish County, Washington, said on Wednesday. Since his discharge from the hospital about 3 weeks ago, the man has remained at home and in isolation at the request of local health officials. He was supplied with groceries, and on Valentine's Day was given a cupcake. But after consulting with state and federal officials, the Snohomish Health District concluded that it was safe to release him from all restrictions. He is now considered fully recovered and free to go about his regular activities, Snohomish officials said in a statement. We cannot thank him enough for his patience and cooperation throughout the entire process. The man tested positive for the virus after returning to his home in Snohomish County, Washington, after visiting family in Wuhan, China, the epicenter of the outbreak. He was admitted to an isolation unit at Providence Regional Medical Center, where his condition worsened before improving. 9 days after his symptoms started, an X-ray revealed pneumonia, according to a description of his case published in the New England Journal of Medicine. He received an experimental antiviral drug called remdesivir on a compassionate basis, which the Food and Drug Administration allows for drugs not yet federally approved. China's banks are lowering borrowing costs for companies and households in a move to try to soften the economic blow of the coronavirus. The move follows a series of policies enacted by China's central bank to shore up an economy hobbled by weeks of a near-nationwide shutdown of businesses. On Thursday, the People's Bank of China said it lowered the one-year loan prime rate from 4.15% to 4.05%, and slashed the 5-year loan rate to 4.75% from 4.8%. Dozens of business owners have complained about China's efforts to contain the virus by locking down dozens of cities. The move grounded to a halt the daily activity of local businesses, including small shops and large factories. Economists are lowering their growth expectations for China this year as businesses are only just haltingly beginning to get back to work. Some said the move on Thursday would do little to address the widespread impact of the epidemic on China's business community. 1/3 of small firms in China are on the brink of running out of cash over the next 4 weeks under the current situation, according to a survey by Peking University and Tsinghua University of 1,000 business owners. Another third will run out of cash in the next 2 months. Many of these firms have already laid off employees. The rate cuts alone will provide limited relief to the millions of small private firms that are suffering the most from the epidemic and are poorly served by formal banking, said Julian Evans Pritchard, an economist at Capital Economics. The coronavirus epidemic has become the latest and potentially most divisive issue driving apart the United States and China. For the fiercest critics of China within the Trump administration, panic over the coronavirus has provided a new opening to denounce the rule of the Communist Party, which they say cannot be trusted. But the hardliners' message has been undermined at times by President Trump, who has publicly commended President Xi Jinping's handling of the crisis and even called for greater commercial ties, including the sale of jet engines to China. "Look," Mr. Trump said on Tuesday, "I know this, President Xi loves the people of China, he loves his country, and he's doing a very good job with a very, very tough situation." It has become a staple of the Trump administration, sending mixed messages that reflect a good cop bad cop tactic, a real internal disagreement over policy or simply the caprice of the president. But overall, the most hawkish voices on China have dominated the conversation, lashing out at Beijing as it reels from one challenge after another: a trade war with Washington, protests in Hong Kong, and now the struggle to contain the coronavirus. Mr. Trump's conciliatory comments this week might be an effort to defuse tensions and keep the U.S. economy humming as he faces re-election. That approach is backed by a pro-trade faction led by Treasury Secretary Stephen T. Mnuchin, which advocates close ties between the world's two largest economies. Whether it is because of the assertiveness of the hardliners, the ambiguities fueled by the competing messages, or Beijing's policies, the relationship between the United States and China has become so strained and unpredictable that even the need for a united effort to address a global health crisis has not overcome the suspicions that have increasingly taken root on both sides. Reporting and research was contributed by Alexandra Stevenson, Russell Goldman, Sui Lee Wee, Stephen Lee Myers, Elaine Yu, Tiffany May, Edward Wong, Makiko Inu, and Aimee Yamamitsu.